Hello. So it's still dealing with the elephant in the room. We'll continue with the neurological examination of the upper limb. So for neurological examination, it's good practice to ask the patient to walk. So you want to ask them to walk about 10 steps away from you and 10 steps back to you. So I'll just walk back so you get an idea of what I'm talking about. So you want to walk 10 steps back and 10 steps. Now, while I'm walking, you would look at the patient walking in three dimensions: from the front, from behind, and from the side. You're looking at any abnormality of gait. Now, once you've done that, you want to ask the patient to walk toe to toe. So sort of like that, heel to toe, heel to toe. And then you want to ask them to stand, close your eyes, and watch whether they would fall. That's called the Rumback's test. So that this applies for both neurological examination of the upper limb or the lower limb. Once you've done this, you want to now start the examination proper. You want to ask the patient to lie down on the couch and expose the upper limb if that's the part you want to examine. So you want to, again, go through IPPA. Remember, we're using a script-wise approach. There are other videos that cover the technique in more details, but we're using a script-wise approach. Now, remember also you would have done wiper plus IPPA. Now back to the neurological exam. Once you've done that, you want to inspect. Once you've done inspection, you would inspect the arm and the scapula, looking for things like winging of the scapula. Once you've done that, you want to ask the patient to do like this and close their eyes. You want to look for pronator drift. So once you've done that, you now want to go into palpation. And I tell people the easiest way to remember what to do, you want to think of tone, power, and coordination. Easy mnemonic to remember this is tell people calmly. Now, tone, you want to think about the joint. So you want to first assess the tone in the elbow. So you want to do this and both sides. Yeah. Then you want to assess that and that. You want to assess that and that. So that does tone. The next is you want to assess power. So you want to assess power in the elbow. So you want to ask the patient to do this and prevent you from pushing them, and then do that. Now you want to ask them to make a fist and and then the other way. So you want to also do that and do that and that and that. You want to ask them to do this, you want to do this, you want to ask them to do that and then do that. You want to ask them to push your thumb. So that's assess power. Then you want to assess for coordination, which in the upper limb you use the finger nose test. So let's assume this is my finger of the examiner, this is the patient's nose. So the idea is you keep going up and down, up and down, and then you assess both hands. So that's the finger nose test. After that, part of coordination is you want to test this dichokinesia. So you want to ask the patient to do this. Then you want to ask them to do it with the other hand. Good. So once you've done this, The other part of the examination involves palpation and percussion. Probably the easiest way to remember this is if you remember red lips vibes and what it contains here, or lip vibes red. It's better, lips vibes red. So you are looking at light touch, pinprick, proprioception, vibration sense, as well as reflexes. So most neurologists would start with the pinprick, but you can do any of this in any order. So you want to come to the sternum and you want to ask them to tell you what they feel, sharp or blunt. Once if they've done that, you want to go to the dermatomal levels. So you want to start with C4, C5, C6, C7, C8, T1, T2. You want to come on the other side. It's bilateral, so it should be, after you've done this, C4, C4, C5, C5, C6, C6, C7, C7, C8, C8, T1, T1, T2, T2. Of course, the patient's eye closed while you're doing this. Once you've done that, the pinprick, you want to demonstrate light touch. Some people demonstrate deep touch, but routinely you can, deep touch and temperature can be ignored. So you want to go the same way. You want to come here, then C4, C4, C5, C5, C6, C6, C7, C7, C8, C8, T1, T1, T2, T2. Now, that does that for light touch. The next is you want to check for proprioception. So you want to come to a distance phalanx, ask the patient to close their eyes and tell them where the joint is. So you want to say, close my eyes, up or down, 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 up, up, down, down. So you do the next one, up or down, up, up, down, down, up, up, down, center, down. So that tests proprioception. Once you've done that, what is left to test is you want to test vibration sense. For this, you need a tuning fork, and you come, you strike, you go to the middle. Can you feel it? Yes. Once patient confirms that, you want to go to Brownie prominence and ask them if they can feel it. If they confirm, you try on the other hand, and then you also ask them if they can feel when it stops. That confirms vibration, test vibration sense. If they can, then you keep going up. Once you've done that, the final thing I like to prefer to do is the reflexes. And there are three of them in the upper limb. You want to start with some people start with the supinators. You want to relax the hand and strike the supinators. And then you want to come here around the elbow, the biceps, and then you want to do that, the triceps. You do that here, supinator, biceps, then triceps. This should complete the neurological examination of the upper limb. Thank you for watching. So a quick recap: you want to ask the patient to walk, you do the heel to toe test, and then you do Romback's test, you inspect. During inspection, you do pronate or drift, you palpate, where you palpate for three things: tone, power, and coordination. And during coordination, you do the finger nose test and this diacokinesia. And then during palpation percussion, you assess for light touch, pinprick, proprioception, vibration sense, and reflexes. Thank you for listening, and please subscribe and like the channel. Bye.